Hi, everybody. So excited to be with you again. Today, we're doing something really special. We are doing our first virtual civics class. I'd like to welcome all the students that are tuning in, all the teachers, maybe some parents who are doing some fun e-learning with their students. And I'd like to welcome Professor Rich Kiefer, who we've teamed up once before. We did a town hall for students at Waubonsee Community College, where he is a professor for political science. And so today, this is what we're going to do. We're going to give a nice little joint lesson. Professor Kiefer is going to give us all kinds of insights, and then I'm going to just share my experience in working with in government and serving in Congress. And then we look forward to answering your questions. So we have this chat. We're in the chat. We want to respond to your questions. So be sure to leave your questions and comments there, and then we'll get to it after a few minutes of presentation. So I would like to turn it over to Professor Kiefer to introduce himself and his role at Waubonsee Community College, and anything else he'd like to share with us. Professor, welcome.
Well, thank you, Representative Underwood. It's good to be with you again today. As you mentioned, I work at Waubonsee Community College, and I've been there for 20 years, and I primarily teach in the political science and history areas. So we're also, the community college is a unit of local government, so we've really been affected extremely by this corona crisis. In fact, at our midterm, we were going to spring break, and while we're on spring break, the governor ordered the stay-at-home order, and we've had to convert for the remainder of the semester to online courses. So that's been a bit of a challenge. And then just this morning, I was checking my email, and we were just notified, based on the guidelines for reopening, we're going to have to go for online courses through the summer, and we're still not sure what the plan is for the fall, but we've definitely been impacted by what's been going on. My students have been impacted by this greatly as well. A lot of questions about what this means. Right before we went to the break in March, I had some students, this is right when the story was kind of breaking, and I had some students that were saying, well, this is just overblown. Isn't it just like the flu? And I responded, I said, I've never seen anything like this to this extent that's affected daily lives. And at that point, they had already canceled, like delayed, I guess, the baseball season and, basketball and other sports. I said, I've never seen anything like that in my lifetime. And it obviously became even more real with the stay-at-home order. So I'm happy to talk about anything. I know we had a few talking points that we wanted to look at the impact on the federal government, the state government, and the local government. And all those, I think we could have spent an hour on each one of those, but we'll try to keep it a little tighter.
Sure. Well, thanks for all that you're doing and for your dedication over the many years to your students. This is a little bit of a different situation, and we know that lots of students and families are coping differently and transitioning to e-learning differently. But we wanted to just be able to create a forum that would be engaging and a little different, and maybe offer people a different way of learning about some fun topics. So first up, we wanted to just talk about government and what government is and how it serves our community. And so let's just start off with a high-level definition of government. Government is how nations, states, and communities literally govern themselves. So it's not just rules, but processes and procedures and execution, right? Delivering services all flow through this central entity that we call government. In the United States, we have a federal government, we have state government in the state of Illinois, and then we have local government. Federal, we have three branches, right? We know that we have the executive branch that's led by the president. We have the legislative branch, the United States Congress, which I serve in. And then there is the judicial branch, the Supreme Court. At the state level, each individual state governs themselves and has, similar structures, but sometimes unique ways of doing business in each state. And then local. And at the local level, here in Illinois, we have a few different layers of local government. We have municipal government, we have townships, we have counties. And so there's a few layers of government there. Professor Kiefer, did you want to say anything about the definition of government or kind of how we structure ourselves in Illinois?
I think you hit the main points there. Every state has essentially what they call a Republican form of government, which refers to the three branches you mentioned. Everybody has a governor. Every state has a legislature. Every state has a court system. Beyond that, though, the way they operate can vary pretty significantly. Some governors are very powerful. Some governors kind of defer to the legislature. Some are more impacted by if you have a very active court system with rulings there. One of the other things I was going to mention when you're talking about government is, in our society, a representative republic with elements of democracy, we live in a civil society where there's kind of a trade-off where you have freedoms, but you also kind of agree to abide by the rules, this idea of collective security and safety. And I think we're seeing a little bit of, give and take and kind of tug of war of what that really means to people. So I know we'll probably talk about this later, but when governors have issued a shelter at home or designated certain industries as essential industries, and some people push back, how does that get resolved? And we're seeing this, even in Illinois with some protests. And you may see the courts being used to try to challenge some of these orders. You have other people arguing that it's a public safety issue, that should take precedence. And we don't have a lot to compare with in the past of this type of experience for a lot of people. Prior to this, I was jotting down some notes, and I was thinking about trying to wrap my head around this. For a lot of people, this virus and the threat that it poses, I think, this is my observation, I think for a lot of people it's very real if they've been impacted by it directly, if they've gotten sick, or they know someone who's sick, or if they've lost somebody or their job. But I think for other groups of people, it isn't real yet because they feel like, oh, I don't feel sick. I don't know anybody that is. I don't see this as a threat, and they're only watching it on TV. And that's a hard thing to try to explain to people what this really is like.
Absolutely. And what their prior relationship with government even is. Because for so many people, they've not had to interact. They're not accustomed to getting orders or requirements to do any specific thing from any type of government official. And so this is a completely new environment.
Well,
so
go ahead.
No, please.
Oh, I was going to say, for a lot of people, they've made historical comparisons to the flu that hit the nation and globe back in 1917, 1918. But a lot of people really don't have a firsthand reference to that. When you had the president declare an emergency, if you compare the things in the past, a lot of times when national emergencies declared for sometimes like natural disasters, we think of like hurricanes, earthquakes maybe, and you see this sometimes trickle down to the state level too. So in Illinois, when we think about emergencies, more recently, you can look at like tornadoes. Flooding is actually kind of a thing that comes up really annually in Illinois. And if you're affected by flooding, that's huge. If you're not, you may not even be aware of this. But when the president declared an emergency, it usually triggers a certain response. And you'll see, we'll maybe talk about this too, but FEMA gets involved. It can release funds, coordinated plans to address the issue. But a lot of it had to do with like kind of physical, environmental threats. Jumping around a little bit, after 9/11, a lot of communities, states, and the national government started developing emergency plans based on perhaps a terrorist threat, some sort of threat like that. This is different, though. This is a health issue. And again, we don't have a real neat comparison to look at the past and see how the government reacted. But typically, when the federal government declares an emergency, there is kind of a coordinated effort and a marshaling of resources, and you try to address something. And, examples I give you with like a hurricane or something, as devastating as it can be, there's kind of like an endpoint. There was a threat, and now you're dealing with the aftermath. The deal with what's going on now is it's an ongoing threat, and it's new to a lot of us, and we're not sure what the end result is going to be.
That's right.
At the state level, when the governor declares an emergency, that can also trigger certain things as well. So like the shelter at home, issuing of essential businesses being to stay open. And we'll probably discuss this. It also triggers requests for certain funds and the releasing of funds to try to deal with some of these issues.
That's right. So let's talk about this new threat that is
Sure.
It has cast a little bit of a shadow on our springtime and certainly has impacted everything that we do in our day-to-day lives right now. So the coronavirus or COVID-19. So according to the Centers for Disease Control and Prevention, which is the federal agency that helps guide us through all types of public health and healthcare challenges, they define a novel coronavirus as a new type of virus in a category of something called a coronavirus that has not been previously identified. So it's brand new. And the virus causing the coronavirus disease 2019 is not the same as the coronaviruses that commonly circulate among humans and cause mild illness year to year, like the common cold. COVID-19, COVID-19 is the same thing as what people call just the coronavirus. And COVID is actually an acronym. It stands for Coronavirus Infectious Disease 2019. And so when you hear that, talked about on the news or people use them interchangeably, that's what it means. And so there's many types of human coronaviruses, including some that commonly cause mild upper respiratory illnesses. So that could be cough, that could be stuffy nose, and COVID-19 is a new disease. And the name was selected following the World Health Organization's best practice for naming of new human infectious diseases. And so this is something that everybody around the world kind of calls it the same thing. That's how we're able to share information with our research partners and scientists from other countries, because literally this is what's called a pandemic, meaning everybody around the world is experiencing the same threat from the same, in this case, it's an illness at the same time, and it's worldwide. And so when that happens, we call it a pandemic. When it's on a smaller scale, we call it an epidemic. And when it's on an even smaller scale, we call it an outbreak. And so this is like the mega scale of disease outbreaks, and we call those pandemics.
I like your explanation. That was good. And I know your background is in health as well. So you did a good job of explaining that. I know there's a lot of, I don't say misinformation, but maybe misunderstandings of what it actually means. And you heard people early on referring to it as COVID-19 because there were 18 that came before it. It's like, no, it's the year that it kind of broke, right? The 2019.
That's right.
And I had looked at a few things too. So when the president formed his kind of COVID-19 response team, they use this term, the Defense Production Act, as they talk about him being able to invoke that. And if you go back in time, in the past, the idea was to take critical industries and convert them to basically a peacetime economy, to whatever the threat is, to try to deal with it. So perhaps instead of making automobiles, you would make military vehicles. In this case, maybe some companies are making ventilators. There are some differences, though, between the president requesting those type of actions versus ordering it. And president has requested, like, some car companies to make ventilators, and they're doing that. More recently, he's actually issued an order to keep meatpacking plants open. And I was talking with this the other day to someone, and I said he can make that order, and it's within his ability, but how does it actually translate? Because, like, what happens if there is an outbreak of this virus at the meatpacking plant and the workers can't go in? Or what if they say, hey, we're not going to do this, we don't feel safe? And just the enforcement of those type of orders, just because you issue an order like that doesn't mean that it's going to have a real impact. People could resist it.
That's right.
There's a lot of talk about, I was looking at how the president issues guidelines. That's different than an executive order. He says, oh, maybe you should shelter in place. Maybe you should do social distancing. That's not the same thing we're seeing at the state and local level. At the state and local level, those are actually orders by the governor. Hey, we're ordering you to stay in. We're establishing these as essential businesses. But it also boils down to and you see this with, like, the city of Chicago as well. The mayor has jurisdiction over her area. But there's a issue of how do you enforce this? What if people don't follow those guidelines? And I always say this in my classes, that the easiest laws and policies to enforce are the ones that you don't have to. Meaning, if people follow it out of common sense or they understand the value of it, those are the easiest laws to enforce, whether it's
Right.
basic traffic laws, don't steal, stuff like that. But with this virus, if you have people outwardly flaunting these orders, what are you going to do? Do we have law enforcement to arrest these people? Is that the end game, or we're going to ticket them? And we're seeing this across the country with governors and local governments trying to deal with this stuff. They issue these rulings, and you'll have people saying, "Well, I'm going to go to the beach anyway and interact closely with people. I'm going to go to church. We're having that as an issue." And kind of ignore these guidelines. And that's where, as I said earlier, I don't know if this is real to everybody until it becomes real.
That's right. So, what you're describing, these orders versus recommendations, who pays
Sure.
for certain things, who
Yeah,
has, quote, the authority to make these types of changes, and they are legal changes,
sure.
has to do with the structure of our government, this unique intersection between federal, state, and local government. There's something that's called federalism that's part of our government system, which means that we have a central federal government that has limited power. And there's been a lot of powers, almost even a majority of powers that have been given to the states.
Sure.
And that dates back to the colonial times when they were first setting up our Constitution, and the first colonial people came over from England, and that they didn't want to have a monarchy with this very strong, all powerful central federal government. And so when we had the 13 colonies, which became the states, and they signed the Declaration of Independence and put forward that first constitution driven by the Bill of Rights, there, baked in from the very beginning, was this idea that states had certain rights and that they could be self-governing in certain aspects. And so that's exactly what Professor Kiefer was describing. The president has the power to make executive orders, and he has the power to activate certain authorities that the Congress gives him, right? So we wrote a law called the Defense Production Act that gives him the ability to enter into contracts with certain companies to make them scale up in times of war or emergency to be able to defend our country, and protect our citizens. And so some of us, including me, have been, really actively encouraging the president to use those expansive powers during this time of an emergency to protect our country and our people. But at the same time, the states have some really unique authorities. So like the stay-at-home order, we heard Governor Pritzker extend that at the end of April through basically the end of May. And that's a unique function that he has as the governor of our state. Professor Kiefer, do you want to say anything else about state level powers or jurisdictions?
Well, very, very much so. And I think you hit one of the biggest points. This goes all the way back to the founding of our government under the Constitution. And without making like a history lesson into this, but
It's okay. That's why we're here.
There was a very, you're right. There was a very real fear of states that you would have too strong of a central government. Especially, they were very fearful of executive power. So if you look at our early history, some of the states had very watered down governors, but they were very fearful of executive power at the national level. And you mentioned the Bill of Rights. Within the Bill of Rights, the 10th, we always think about how it affects our own individual freedoms and limits on government that affect us. But the 10th Amendment actually lays out and reinforces that states have powers. And it basically states that anything that's not strictly a national issue and given to the national government by the Constitution falls to the states, or even more specifically, the people. So it reinforces that states have huge amounts of power. And you see this in a lot of ways, and if it's not in the U.S. Constitution, you look at something like issuing of a driver's license, requirements to graduate from a high school, local taxes, local elections, state elections, that all falls to the states. So states have enormous powers and leeways. That being said, we have 50 different states, and there's been some trends, but we're seeing different reactions from some states. Some states actually never even had a shelter in order in place, which was very few states, but like Arkansas, for instance. Most states had some variations of that. We have a lot of states reopening, and we're seeing this happen in real time. Is it going to be a setback? Are they successful? Is every state the same? I noticed just earlier in this week, our governor Pritzker basically came out with some guidelines for how to open up the state, and he has these like 5 benchmarks that areas are going to have to hit, and he's divided the state up into essentially 4 geographic areas, and he's saying even within Illinois, not every corner of Illinois is exactly the same. They may emerge from this differently. One of the common themes he stressed was to get back to full normalcy, back to how life was before all this. You would basically need to hit a benchmark of either having some sort of treatment that's 100% effective, or the ability to inoculate yourself from becoming infected. And that doesn't look like that's anywhere in the immediate future.
And you inoculate with a vaccine for people that don't know what that means. That's right.
Exactly, vaccination. And that may come at some point, but who knows? I think the more realistic approach is going to be, you're probably going to have to wear face masks. You probably are going to have to distance yourself from people. But I was talking with someone the other day about just this notion of what's an essential business and what isn't, and this has a huge impact not only but state government's revenues. So if you look at like the national government of revenue is individual income tax. Over 44% of the federal budget comes from income tax. So, can you still hear me?
Yes.
Just by unemployment going up, revenues for the national government are going to go down. Just by the federal government saying, hey, we want to help people, we'll delay the April 15th tax day to July, that's having a ripple effect. At the state level, I think this is even found because the state of Illinois relies on, we have an income tax, but we rely heavily on sales taxes, gas taxes. They use this term sin tax. If you look at how road work is funded with tolls and stuff, if people aren't driving, that goes down. If people aren't driving their cars, they're not buying gas. Right. There's all these ripple effects. And then again, when you have people out of work, this is not something, even if we get back to 100% normal, whatever that might be, this is going to have a ripple effect for a very long time.
That's right. And so recognizing that there are a lot of costs associated with a significant emergency like this, both
right.
Lost revenues, so meaning communities and cities and states don't have the money that they once did to continue to fund their police officers and fund the health department and do all those activities.
And in a lot of ways, the demand for those services actually shoots up in times like this. So the demand for government services goes up, but the revenue and streams to deal with it are actually going down. So.
That's right. And so the Congress recognized that, and we passed something called the CARES Act. And that was on March 27th. And that is another acronym, but that's okay. But it's spelled CARES. CARES Act. And this bill responds to the coronavirus pandemic and its impact on the economy, on public health, on state and local governments, on individuals, and on businesses. And so what the CARES Act did was a lot of things. Many of the students watching might have heard their parents talk about stimulus payments or rebate checks. Did they get the check? It's $1,200 that went to every taxpayer who had an income up to a certain level. And then it had some money for dependent children under age 17. And some people got their money direct deposited into their bank account. Some people got a check mailed to their home. And some people are still looking for it and they call our office, and we encourage them to still reach out. If you haven't gotten your check and you think you should get one, we are happy to help you. There's also things in the CARES Act related to unemployment insurance. And so we know there are a lot of people around our community, a lot of people around our country who've lost their jobs related to the coronavirus pandemic. Maybe their small business that they worked for closed temporarily. Maybe there's just less of a demand for their skill. And, there's not a lot of work for them to be doing right now. There's been a lot of different circumstances. Maybe they're like, if you were a student and your college closed or university closed, then there went your work study job. And so there's been a lot of circumstances where millions and millions and millions of Americans over like 30 something million, I think we're up to
Yes.
40 million, something like that, unemployed right
Mhm.
now. And it's just been devastating for so many families. And so in this bill was more money for people to get unemployment insurance, which is a way that they're able to get um, some compensation to help them pay their bills during the time when they're out of work. There's also student loan relief. So there's many people who have to take out student loans in order to go to college or community college. And if you have a federal loan, then you don't have to repay that federal loan while the pandemic is still hurting so many of us in our communities, and that the loans are being uh, basically like paused until the end of September. You don't have to pay any interest. It's not accruing interest. You don't have to pay your principal, and it's not going to accrue any fees or penalties for this type of delay. Additionally, we've been supporting small businesses. And so, if any of the students watching have been watching the news lately, they've been hearing about something called PPP, the Paycheck Protection Program. And what that is that it's funding for small businesses who had employees that can no longer afford to pay their employees because they're not collecting revenue, right? They're not selling their goods or their services. And so it allows for the federal government to give a loan to that small business. And if that small business owner keeps their employees on staff for 8 weeks, the federal government will forgive that loan. And so then that's preventing those small businesses from having to lay off or something called furlough, which is basically like people are laid off, but they still have their job. They're just not getting
Mhm.
paid for their job right now. So they're not fired. Their job didn't go away. They're just
Yeah,
not
and that could
actively
affect
working, and they're not
and that
and
could
they're
im-
not earning an income, right?
and that could impact their benefits and if they have health
Exactly.
care and all
Exactly. But then the federal government is going to pay the small businesses, and then the small business can pay their workers. So then it prevents people from losing their jobs and having to get on unemployment. So that money was very, very popular, so much so that the federal government program ran out of money. And so we had to backfill it. So we've been doing lots of public events like this one, but targeted at parents and adults and small business owners and all types of folks through Facebook Lives and town halls. And so we're really excited to be able to do this one oriented to students. So again, for all of our students that are watching, we're going to invite you to put some comments and questions in the chat box, okay? Because we want to get to your questions in about 5 minutes. So I'll turn it back over to Professor Keeper to see if he has any more comments.
Sure, I'll just say kind of one thing in general here. So when from the White House, if they issue guidelines, that's not the same thing as an executive order, but they've issued guidelines to stay in place or social distancing. Well, that's not the same thing we're seeing at the state level.
Mm-hmm.
So I wanted to point out if the president says, "Hey, we'd like to see states start opening up," or "We're going to lift our federal guidelines," they can do that, but that doesn't necessarily mean it has an immediate impact at the state or local level, because keep in mind the shelter in place orders, those originated with the governors, meaning the president didn't shut down the country. It's mostly at the governor's level, and then even within that, the states. So I'll make one other point. If Governor Pritzker was to say, all right, we're going to lift the shelter in place order, okay, we're going to lift that tomorrow, that doesn't mean it's going to affect everywhere. You might still have Mayor Lightfoot in Chicago saying,
Mm-hmm.
Chicago's ready for this. We have other concerns. We're going to keep our order in place. So there really is this ripple effect of different levels of government dealing with this. You mentioned the county as well. Counties have jurisdiction in that sphere as well. So this is why you kind of end up with this patchwork of responses taking place. But
That's right.
it's big. You mentioned the impact of jobs and stuff. If we just throw some data around, um, literally 5 months ago, the national unemployment rate was reported as under 4%. The latest data I looked at now, just in April, it jumped to 16%.
That's
That's
right.
huge. That's a
That's
huge
right.
amount. And I told you that the ripple effect is that those people, if they're not paying taxes, if they're not buying things, it has a ripple effect at all levels of government that it's going to be felt for a long time.
That's right. And so during this crisis, the three branches of government at the federal level are very active. You hear about what the president and the executive branch, and so in the executive branch, again, that's all the agencies. So Professor Kiefer talked about FEMA. We talked about the Centers for Disease Control and Prevention. They're all very active. The judicial branch is very active. Actually, for the first time ever, the Supreme Court is live streaming their proceedings.
Audio, right?
So yeah, and so you can listen in to their debates and discussions. Yesterday, they were talking about some healthcare matters. There's a lot going on at the Supreme Court, and every American can listen in now due to the coronavirus. And then the Congress is meeting. We're actually going back probably next week to consider another bill in the House. The Senate has been in session this week. They're not really doing a lot coronavirus related this week. They're working on some judges because the Senate has to confirm judges at the federal level. And then the State Department, you might have heard about them. If anybody has a passport, the passport comes from the State Department. And the State Department has been very busy trying to get Americans who are either vacationing abroad, studying abroad, working abroad, living abroad, meaning in other countries that want to come home, trying to help get them back to the United States safely. Because a lot of countries have closed their airports. It's been very difficult for Americans to be able to travel back to the United States in order to get any health care or to be able to stay at home literally during the coronavirus pandemic in their community, in their country. So the State Department has been very, very active as well. So I think that we might be at the designated time for questions. And I know that there have been some that have been pre-selected that my team was going to chime in and ask us for the conversation. So I'll turn it over to them.
Yes, hello, Congresswoman Underwood and Professor Kiefer. We have had a few pre-selected questions from students emailing in. So one of them is, it gets a little bit more local. What is the role of our county health departments and how has it changed during this pandemic?
I think that's such a great question. Professor Kiefer, do you want to take it first, and then I'll fill in as needed?
Well, I know your health background probably is applicable too, but one of the things we see at the county level and the way it's set up is they would track and try to look for any type of health outbreak. So it could be something like measles, a whooping cough, things like that, and they try to pinpoint where these cases are, and they try to assess what a threat it is to the greater area. So yeah, that is taking place. So if I was looking before this meeting, if you look at how they track it, most of it's done at the county level. Some of it's tracked by zip code, but really it's the counties that keep track of these things.
Yep. So the county health departments, every county has a public health department that monitors and responds to health issues facing our communities. So sometimes, depending on what's going on in your community, the emphasis might be different. Some communities, they talk a lot about HIV. Some communities talk a lot about drug use and opioid addiction. Some communities talk a lot about smoking and obesity. It just depends on what's going on in that community. But right now, all of our health departments are very busy working on the coronavirus. And so what the county health departments do is that they give the communities information that they need to make healthy choices, to be able to develop and carry out public health policies and plans. So that means like if you are required to wear a mask, right? Usually that decision at your city or county level is made in conjunction and consultation with the health department, because that's where the community's doctors work, right? So think about it like this. Your county, I live in Will County, Professor Kiefer works in Kendall County, right? That county has a doctor for that county, and that doctor works at the health department. And so they make some best advice to help take care of everybody in the community. Now, some health departments also provide services directly. So, for example, in Lake County, because we have a lot of constituents that live in Lake County, their health department runs clinics, and they do a fantastic job actually taking care of residents in Lake County. And so each county has different types of services, but the core services that they provide is related to advice. They write plans and issue reports. They give a lot of data so that we can track the disease spread locally. And they're a great resource for all of us. And so if you have questions related to the coronavirus and its impact locally, you can reach out to your county health department.
And especially if a vaccine is developed, you would see that trickle down at that level certainly as well.
Yep, they're definitely involved in mass vaccination.
Like administration. Sure.
Okay, our next question is in regards to the, the the National Guard. What is the National Guard's role in this pandemic?
Well, I would say hopefully limited, but we've actually seen them called up and be used for creation of like hospital beds, treatment centers, testing, drive-through testing facilities and stuff. So they've been involved with that. I had someone in class the other day ask me about the concern of like using them to try to enforce like stay-at-home orders, and we haven't gotten to that point. I hope we don't. That's almost like a martial law type situation. But usually in the past, what we look at is with natural disasters, they try to come with relief. They might be building new drainage or roadways to try to get emergency supplies in. But usually it's at the well, it could be ordered by the president, but usually at the request and ordering of the governor is when we tend to see that happen.
That's right. And they have been awesome and so incredible. These are people, National Guards, men and women have day-to-day jobs, but then they also serve our country. And so during times of emergency and war, they can be activated kind of like, I don't want to call it off cycle. They have their routine commitments, and then sometimes their units are called up when they're specially needed. And so we have some people that have been called up to serve our communities during this time of coronavirus, and we're so grateful for everything that they do.
And I have students this semester that were on active reserve, and they've been called up for that very same reason to provide services and help out. So it's impacting us.
Thank you. We've got time for about 2 more questions. Congresswoman Underwood, could you touch on just one more time what Congress's next steps are? What's going to be happening?
Yes. So we have passed 3 big coronavirus-related supplemental spending bills to address testing, to address small businesses, to help our states and cities, to help our health departments, to give all sorts of extra money for families who might need help. We've passed changes to say that people can't get evicted from their homes during the time of the coronavirus if they had a federal mortgage loan, things like that. So we've been doing lots of work on the coronavirus since very beginning of March, late February. It's when we first started doing these types of supplemental spending packages. But we know there's some more work to do. So we've been working on a bill that we're referring to as CARES 2, so like the second part of CARES Act that we've been working on. And our office has a lot of priorities that we're fighting for to get in the bill. If you want to know what we're working on related to the CARES Act, you can go to our website, underwood.house.gov. But we are compiling that bill, and I think that we're going to bring it to the floor of the House for a vote next week. So I've gone back to Washington every time we need to vote, and usually we go back just for the day to go to the floor, have a little bit of debate, I give a speech, and then I cast my vote in support of that legislation. And so I expect to do the same thing next week, but the time is a little bit fluid because the bill's not quite done yet. We haven't seen the actual document. And these tend to be like thousands of pages, very, very, very dense. And you have to have time to carefully review it also because it's a lot of money. We have to be good stewards of the taxpayer dollars and make sure that these programs are actually going to help people in the way that we intended. But the one thing I do want people to know, I'm sorry, one second, we don't have the ability to vote remotely yet. So if the House is going to be able to vote on these items, we have to physically go to DC. But next week, we expect to be able to pass a rules change that would allow during times of emergency for the House members to be able to vote remotely or by proxy. So we're going to get some more information about that as well.
And that would be huge because that's never taken place in our
That's
past
right.
as well. Now of course, the
Ever.
technological differences are, I think we have different options today, but it's never happened in the past. A lot of states are struggling with the same thing as well, and city councils as well. How can they have to rule so they can do the business of what they need to deal with? One of the things I do besides my job at the college is I serve as the chairperson of our plan commission and zoning board, and we've had to switch over to. I just had this Tuesday night a Zoom meeting, so we can conduct the business of the planning commission. And otherwise, everything grinds to a halt. You can't do anything, and there are certain laws you have to comply with, like the Open Meetings Act and the ability to take public comment and things. I did want to mention this because this relates to the ledge talking about next week. So there's a lot of debate going on. What's the role of the federal government? Should the federal government try to bail out or assist state and local governments? And there's a lot of discussion taking place right now about that. But I want to point out to people that the federal government is in a different position. They can actually take on debt. They can borrow money. They can take on debt. That's within the Constitution. Before all this happened, we were at a national debt of about, I don't know, $22 trillion, but they were able to take money on. Many states and local governments cannot do that. They can't borrow their way out of this. And they really are in a bind. And there's some debate whether should you just let them flounder? Should you let them be able to declare bankruptcy? States currently can't do that. There are some examples of municipalities going into bankruptcy, but those have huge repercussions. People leave. People don't want to invest in areas that happens in. But this is unprecedented. And when you look at what the state needs and the local government needs, where can they get those resources? And currently in Illinois, again, we rely heavily on things like sales taxes. In Chicago, for instance, there's an occupancy tax. Following the local news, when they talk about canceling things like sporting events or concerts or trade shows, it has a huge impact on the economy. All those people staying in hotels, money from out of state coming in, and that money's lost. It's not like we're going to make it up with twice as many concerts or trade shows next year. So this is, I think, a very serious issue that needs to be looked at.
That's right.
My own unit of local government that I work at, the community college, same thing. We don't know what this means in the fall. Are more students going to come to us? Are they going to go strictly online? Are they going to take a gap year? We don't know. We have nothing to compare this to.
That's right.
Thank you. And just one final question. Congresswoman Underwood, how do we get in contact with you, your office, and other members of Congress?
Well, I'm so glad you asked. We do a lot of things to be in touch with our community. The first is we have forums like this. So while we all have to stay at home, we like to stay connected. And so we've been doing these types of Facebook Live events a couple times a week. Sometimes we have telephone town halls where you can ask questions, and those will continue. We have a website, underwood.house.gov. And if you go to that website, you can email us. And we get your email and we write back. If you are watching this and you don't live in the Illinois 14th Congressional District, you have to put your zip code in. And when you put your zip code in, it'll tell you who your member of Congress is. And then you can email your member of Congress so that they can best serve you. The other thing that we encourage people to do is if they have any questions, you can call our office. Now, I get the phone number wrong, so I'm going to get it right this time because we don't want to give out bad information, particularly for something as important as this. So our office phone number is 630-549-2190. And even the students can call us. We are happy to help everybody in our community because we know this is such a tough time. There's a lot of information that's being shared. Sometimes it's very confusing, and we want to make sure that everybody has what they need. Okay, so we are trying very hard to make sure that we remain in touch with people throughout the 14th Congressional District, and we welcome your suggestions about ways to do it better and to do more.